Hello, Lyme warriors. Today I wanted to talk a little bit about Lyme disease, what it is. I'm assuming you have a little bit of an idea of what it is since you're here and you found me and you're in this group and you have the diagnosis. But Lyme disease is a little controversial. You've probably found that out yourself. Not every practitioner has the same idea on what it is and how to treat it, how to diagnose it. It's definitely a lot more controversial and not clear cut compared to other diseases out there. So I just wanted to give an overview on what Lyme disease is, what we do know, what we don't know, what theories there are out there, so that you have a little bit of a well-rounded idea. And you can use that when you talk to healthcare practitioners who may have different views on Lyme disease. So Lyme disease itself is the name of the disease that's caused by the Borrelia bacteria. So this bacteria is Borrelia burgdorferi. At least that's the common one in the US. So there are different strains. There are different Borrelia strains that you can get, and not all of the testing looks for different strains. So we could talk more about testing at a later point, but there are more than one strain out there. So that's part of the confusion with getting the diagnosis, depending on what they are testing for. Now, where is this bacteria found? The most common place that we think of getting Lyme disease from is a tick. So deer ticks or black-legged ticks are the most common carriers of this bacteria. So a tick bite is the most common way to get Lyme disease. But there is some scientific data that there are other carriers of the Borrelia bacteria, like fleas, mites, flies, mosquitoes. The scientific data isn't as concrete there, but those may be possibilities. Also, there's some scientific data to suggest that it might be sexually transmitted. So that's not something that the CDC confirms. So that you will definitely get different views from different practitioners you talk to about that. But that's something that you might want to keep in mind. If you're going through treatment and you're having unprotected sex with a partner who might be a carrier, you might be reinfecting yourself. So just something that should be on your radar. Another thing is blood donations. They may not be screened for all of the different bacteria and co-infections that can come with Lyme disease, tick bites. Also, it can be transmitted through the placenta, so it can be transmitted during childbirth from mother to child. So there are different ways that you can get it. If you don't have the clear-cut tick bite with a clear-cut bullseye rash, it might make the diagnosis more challenging for you. So just something to be aware of. And the diagnosing is one of the things that is not clear-cut with this, and that's because of the things that I mentioned. So after the tick bite, the textbook version of Lyme disease is that you get a bullseye rash, and that confirms that it is the bacteria that causes Lyme disease, and then you get treatment. The problem is the number of people that actually get the rash is not very high. I've seen different numbers, but up to 30% seems to be the maximum. So that means most people aren't getting the rash. Most people might not even know that they got bit by a tick because ticks are so small. They can be the size of a poppy seed. So it's possible that you don't have a engorged tick on you that you're pulling off and seeing. It could be that you were bit by something so small and you didn't notice it. There's also mixed data on how long the tick has to be attached before it can transmit the bacteria. It does seem like if it's 24 hours or more, there's a greater chance, but there is data out there to suggest that you can transmit it even within just half an hour. So again, there's no clear-cut answer there. And if the tick is that tiny that you can barely see it, do you really know how long it was attached to you? So there's a lot of things up in the air surrounding Lyme disease, surrounding the diagnosis, how you get it, the definition of it. So a lot of practitioners will look at the clinical picture because the history might not be clear-cut and the testing might not be clear-cut. I won't go into the testing too much, but like I said, there's different strains. The testing looks at antibodies, so you have to mount an antibody response to get results. So there's a lot of drawbacks with the testing, and working with a practitioner who's really knowledgeable about Lyme and knows what things to look for clinically can be really important to kind of put the pieces together. Another thing with the diagnosis is, chronic Lyme versus acute Lyme. Does chronic Lyme exist? Or what stages of Lyme are there? Or persistent Lyme, or however you want to call it. There's different terms. There's a lot of controversy surrounding that. So to some practitioners that follow the Infectious Disease Society of America guidelines, their thought is you treat the bacteria with antibiotics. The antibiotics kill the bacteria. If you have any issues after that, it's in your head. It's the aches and pains of daily living. Well, I think as a Limey, speaking to fellow Limeys here, we know that's not quite true. There's a lot of things that can happen with this. So maybe you did get treated right away, but the antibiotics didn't kill all the bacteria. Maybe you have multiple co-infections and there's co-infections causing issues, and the bacteria that were chosen were for the Borrelia, but they weren't for the other co-infections that you had. So now you have problems that are still Lyme related, but they're due to other bacteria or parasites or viruses that were transmitted with the tick bite. Maybe you didn't know that you got bit by a tick, or you didn't know that you had Lyme for several years. Maybe you were misdiagnosed. Maybe they told you you had MS or various other things, depression, fatigue. So many symptoms that go along with Lyme disease are just not specific. The main symptom that's specific is the migrating joint pain. That's pretty specific toward Lyme disease only, but many other symptoms can be seen with other diseases. And we know there's a lot of symptoms that can go along with the Lyme disease. So prevalence, we could talk about the prevalence a little bit. We know that Lyme disease is pretty much everywhere. So when prescribers, physicians are looking at you and you got a tick bite and they tell you that Lyme disease doesn't exist where you are or in your state or in your county, it's pretty much everywhere. It is concentrated to the East Coast in the U.S. and the West Coast, definitely higher prevalence there, but it's up to Canada, throughout the U.S., down to Mexico. It's in various other places in the world like Europe and South Africa and Australia. The incidence of it is increasing. And the CDC says that there's 300,000 new cases a year in the U.S. But we know a lot of times it's underreported, or there may be people that are misdiagnosed, undiagnosed, diagnosed in an unconventional way because the testing wasn't positive for them, and so they had a clinical diagnosis and that doesn't meet the CDC guidelines. So there's many reasons that the numbers are off. What we do know is that Lyme disease is 6 times more prevalent than HIV/AIDS and 2 times more prevalent than breast cancer. So there's definitely an epidemic going on. It's definitely increasing in prevalence, and it's important to be aware, to get the word out about Lyme disease awareness, and realize that it comes in different shapes and sizes. So it's not always a clear-cut picture. For some it might be. You might get a tick, you might find the tick, you might test the tick, you might have a bullseye rash, you might have positive test results yourself, and the antibiotic treatment might work. But we know that that's not everybody, and most people are a lot more complicated, and most people pick up different co-infections along with the tick. And I'll talk about co-infections in my next video because that's such an important part of Lyme disease, that it's hardly ever just the one bacteria. It's usually other things going on, and it's also the host. So maybe if you were completely healthy, your body would be able to clear the bacteria and it wouldn't be an issue. But maybe there's something that you don't know that's going on. Maybe it's mold exposure or heavy metal exposure, or there's something wrong with your immune system, some mutations that you have that don't allow your body to detoxify normally, to get rid of things the way that they should. So there could be definitely different things going on. So that's my overview on what Lyme disease is. Again, it's very controversial. It's not completely clear-cut. You might have to see more than one practitioner. You might have to look for answers and really do your own research and really dig within to figure out what's going on. But what is important is that you seek treatment as soon as you can. Left untreated, this bacteria can take over. It can go to your heart, it can go to your brain, it can go to your nervous system. It can wreak havoc in different places and become life-threatening. So if you have something going on, I do recommend that you seek out a Lyme literate practitioner. I'm biased toward functional medicine because functional medicine looks at the root causes of issues, and a functional medicine approach is what really helped me get well. But there are a lot of good Lyme literate doctors out there, whether you want to go with Western medicine, Eastern medicine, naturopaths. You have to find the best fit for you. But I do recommend, if you suspect Lyme disease, if you've confirmed Lyme disease, that you definitely seek treatment as soon as you can. Thank you, and more to come soon.